Myself, Dr. Karnakara BP, Professor Head of the Department of Pediatrics, Sri Siddhartha Institute of Medical Sciences, T. Beguru, Bangalore. I'm going to speak to you on one of the most important topic that's relevant to today's Indian government's goal actually. Government of India has set a lot of goals to ensure that its public is having a good health and lead a good life actually. In that context, Anemia Mukt Bharat is one of the major initiative of Government of India. So I'm going to speak to you on Anemia Mukt Bharat today. It's one of the most important topic for us to all to understand. It's going to be covered under various headings like what is the global scenario, what are the causes, what is Anemia Mukt Bharat in glance, why this is implemented, what are the similar programs in the country and the world actually, and what are the most successful intervention of Anemia Mukt Bharat in few states actually, what are the major achievements and what are the successful intervention that has helped in containing anemia in some countries, some states like Madhya Pradesh and Haryana, and what are the limitations and roadblock to Anemia Mukt Bharat, and what are the future goals of this Anemia Mukt Bharat. As I already pointed out, Government of India has the reason to consider Anemia Mukt Bharat. If you look at this graph, you can see that nearly 1.9 billion people worldwide is affected by anemia actually. Similarly, 90% of these cases are in the developing countries. We are also part of the same thing. And 85% of anemia cases have been found in Africa and Asia. It means practically across the world, nearly 85% of 1.9 billion of people have been affected by anemia are there in either Asian countries or in African countries. Look at this image. That's very interesting to show that anemia affect about half a billion women of the reproductive age across the world. Half a billion is a massive number, almost close to about 500 million women in the reproductive age group have been affected by the anemia. Similarly, data from 2011 suggests that almost about 29% of non-pregnant women and almost about 38% of pregnant women aged between 59 to 49 are anemic. So this slide suggests what is the implication of anemia in the and what is the burden of anemia in the society across the world, and why it's necessary and why the Government of India has taken initiative to do Anemia Mukt Bharat. So coming to the causes of anemia in India actually, especially when we look at anemia in India, children are one of the major population where anemia has been rampant. The causes includes faulty infant feeding and young child feeding practices. As we know, the infants has to be fed with exclusive breastfeeding up to 6 months. Then we have to introduce weaning food. From there, we have to educate the parents and children to adopt appropriate home-based, culturally sensitive, culturally acceptable dietary habits. There is a fault line in this only that's a significant cause of anemia in the country. Exclusive breastfeeding is the most important thing. Unfortunately, that's been not practiced exclusively across the country. Similarly, we also know that exclusive breastfeeding also may contribute to the anemia because the breastfeeding contains less amount of iron. So children continue to have an exclusive breastfeeding for a longer time without introducing proper weaning or at increased risk of developing anemia. Dietary deficiency is quite significant in Indian population. There could be presence of iron absorption inhibitors in the food actually. Parasitic infections like hookworm infestation and malaria is a major reason for children developing anemia in the school age group. Poor iron stores during infancy and childhood, as I already told, is an important reason. Children who are on exclusive breastfeed have a less amount of iron. So naturally, if they do not get adequate amount of iron supplementation, they will have a less iron storage. Similarly, in the childhood also same thing continues. Same thing can also be the reason for anemia in pregnancy also. We also know that there are hemoglobinopathies contributing significantly for anemia in India. That includes thalassemia and sickle cell anemia. They are quite significantly affecting population in few states. In those states, they are additionally contributing to the development of anemia. In summary, basically, a faulty feeding, dietary insufficiencies are a major thing, and then followed by the parasitic infection as a major reason for anemia in children in India. So coming to Anemia Mukt Bharat at a glance, this program was launched in 2018. It was also called as Intensified National Iron Plus Initiative. That's the main thing, the name for this program. and it's been called Anemia Mukt Bharat. It's complying with the targets of Poshan Abhiyan, the National Nutrition Strategy by the Government of India actually. So it's one of the subcomponent of ensuring adequate nutrition, good health to the citizen. Anemia Mukt program has been introduced actually. The main objective of the program is to reduce the prevalence of anemia by almost about 3% point per year among children, adolescents, and women in the reproductive age group of 15 to 49. So that's how it's been conceived. So why this program is implemented at national level? As we know that India has got a sustainable developmental goals by 2023. Government of India, as per the direction of WHO, has set its own sustainable development goals for 2020 that includes eliminating malnutrition. There are goals includes one, sustainable development goal number 1. What it says, Government of India want to ensure that there is no poverty in the country by 2030. So accordingly, anemia is estimated to contribute about 17% of lower productivity in heavy manual labor and 5% of lower productivity in less manual labor patients. So if anemia is controlled, it achieves in controlling the poverty. That's how it's been considered as a need for national program. Second, sustainable goal development of the country is to have a zero hunger. But the Government of India want to see that nobody is suffer from hunger in the country actually. As a part of it, what it says, anemia is a part of all forms of malnutrition. Anemia is there in all forms of malnutrition that's been documented in the country, which is committed to end by 2030 and addressed by 2025 the nutritional needs of adolescent girls, pregnant and lactating women. What does it mean? Government of India want to start addressing the needs of the anemia nutritional requirement by 2025 among children and adolescent and pregnant ladies. By 2030, it want to contain anemia by almost about 3% per year as we discussed in the previous slide. So one is no poverty where anemia can contribute. Second is the zero hunger, there anemia is also required to control. Third sustainable goal where anemia is necessary to look at is good health and well-being. It's been noted that maternal mortality, iron reduces maternal mortality by almost about 20%. So it means 20% of the maternal mortality is being contributed by anemia, and iron supplementation can significantly reduce in containing this problem. So that's why it's been important. Similarly, another point in the good health is that among children, iron prevents IUGR, it prevents low birth weight, it prevents prematurity, it enhances immunity, reduces frequency and severity of infection, and decreases childhood mortality. And third point is that it's also necessary to treat anemia with respect to malaria caused by hemolysis and anemia. This slide clearly reflects among children and women anemia, how significantly affecting the health of the individuals, so how it's going to impact supplementing iron and preventing anemia. So another goal number 4 is quality of education. We know that very well that children who suffer from anemia have a concentration issue, have a learning disability, have a poor scholastic achievement. So basically enhancing or supplementing iron increases immunity, reduces frequency of infection. That's another reason for children to have skipping the school actually. So if children are healthy, by improving anemia, if it's going to improve the immunity and prevent infection, children can go to the school, their performance can improve, their learning capacity can improve, and their scholastic performance can significantly improve with containment of anemia. So that's how it helps in improving the quality of education. And it's also found that supplementing anemic therapy is going to change gender equality. We know that anemia is more common in girls than boys. So improving iron stores in the women, that helps in improving the women health and increases the productivity and the performance of the workplace. So in this background, Government of India has decided to look at anemia as a major component in providing or improving the health of the nation actually. So what does it do? Anemia Mukt Bharat at a glance, basically, it has a 6x6x6 strategy to combat anemia. 6 strategies to combat, say 6 beneficiaries, 6 institutional mechanisms, and 6 interventions to address. That's a component of Anemia Mukt Bharat. Approximately 450 million beneficiary. It means almost about 50% of the country's population is covered under Anemia Mukt Bharat. I just wanted to highlight that since independence, when independence was given to the India, India was the poorest country actually. At that time, we were basically struggling with lack of food and hunger actually. Over a period of time, government of India in the last 50, 60, 70 years has been able to contain and improve the nutritional status by various mechanisms. That also includes to the status where now we are looking at controlling anemia, which is significantly contributing to the health of the children, people actually. So what is these components actually? 6 beneficiaries. Who are those actually? It contains 124 million children aged between 6 months to 5 years. Another 134 millions between 5 to 9 years. 115 millions in the adolescent age group of 10 to 19 years. 30 million pregnant women has also been covered. 27 million lactating mothers have been covered. 17 million women in the reproductive age has been covered. That's the 6th beneficiary of Anemia Mukt Bharat. So he estimated that close to 450 million people, approximately 50% of population has been covered by Anemia Mukt Bharat. So what are the interventions? 6 intervention. The 6 beneficiaries have looked at that. 6 beneficiary intervention include: number 1 is prophylactic iron and folic acid supplementation. So to ensure that in this population, they are going to give prophylactically iron and folic acid supplementation. Periodic deworming of children, adolescent, pregnant women. That's an important component to improve the health and prevent anemia. Third point, intensified year-round behavioral change communication campaign like solid body, smart mind, delayed card clamping. These are the things where intensified year-round behavioral change communication campaign, where it's going to say a solid body is going to have a solid mind. It's going to educate people and necessary to keep good health. And it also suggests a delayed card clamping itself can cause significant containment of anemia in young infants actually. Then testing anemia using digital methods is another component of the program, where point of care treatment, wherever they go, testing is done, treatment can be advised there itself. Mandatory provision of iron, folic acid, fortified foods in the public health system. That's been followed now. Wherever a public health distribution happens, they try to provide the iron and the folic acid supplemented food. And then of course to have addressing non-nutritional causes of anemia like hemoglobinopathies, malaria and fluorosis. These are the 6 interventions meant to achieve the goals of Anemia Mukt Bharat. So what are the 6 institutional mechanisms? Intra-ministerial coordination. They want to ensure that inside the Ministry of Health and Family Welfare, where the adequate coordination happens to ensure that the program is implemented properly. And then second point is National Anemia Mukt Unit, to create a separate unit which is going to focus on ensuring implementation of the program. Third point is National Center for Excellence and Advanced Research on Anemia Control. That's another major component. As much as program has been implemented, the studies will be conducted to ensure that the efficacy of the program and how the program has been impacted the health and removal of anemia. Convergence with other ministries, where beside health, it could be food, it could be other distribution, concerned ministries, all ministries coordination to ensure that program has been implemented. And strengthening the supply chain, that's the most important. We know that unless otherwise iron supplementation and folic acid supplementation is made available to the people, it's not going to serve the purpose. In this level, strengthening logistical supply and providing iron folic acid supplementation is a major issue with government of India is going to ensure this program that it's going to be taken care of. And of course, to have a digital portal, one stop for all kind of information with respect to anemia, so that information reaches to the public, service provider, everybody in one place where it's been effective. So there are 6 beneficiaries, 6 mechanisms, 6 institutional mechanisms, all are required to ensure that it's been given actually. So is it that Government of India is the only one to implement this program? Not necessarily. This program, various programs like this have been successfully implemented across the world. You look at here, Global Alliance for Improving Nutrition has implemented iron folic acid supplementation fortification of the food in various parts of the world earlier itself, and this has been found to be very effective in improving the nutritional status of millions of people across the world. Similarly, similar programs, as I told, USAID, United States Aid, is also been supporting this kind of programs. India and various other developing countries, they have been effective in reaching out and providing daily multivitamins to the children and basically, and also to the mothers, and also to ensure that improve antenatal iron and folic acid supplementation, anti-malarials, anti-helminthics, beside giving iron folic acid supplementation to the necessary population. So it's not just government of India, even global mechanisms are also there in providing these services actually. Then coming to similar programs, was the first program to be implemented, or is it there earlier also? Government of India in as early as 1970 had similar programs like National Nutritional Anemia Control Program was already there. There was a weekly iron and folic acid supplementation is also given. There was National Iron Plus Initiative Program was also there. So basically, Anemia Mukt program, Bharat is basically intensified national program. It's been already been practiced at various degrees in the country, and this has been intensified with respect to achieving the goal of eliminating malnutrition by 2030. Anemia control, Anemia Mukt Bharat program has been implemented. So the most successful intervention is what? Nutritional education and promotion. Teaching the public and the society that a proper nutrition has been significantly effective. That's what's been part of this program. Access to iron and folic acid supplementation has been another important thing. In improving sanitation and hygiene, basically you know that helminthic infection is an important cause, so improving sanitation can is also improve on that. Food fortification, as we are already discussing that over the period of last few decades, food fortification has been significantly helped in containing various diseases, including the salt supplementation, like iodine supplementation has been able to eliminate the goiter. Similarly, the iron folic acid supplementation is found to be effective that way. Mass drug administration, Government of India is also has policy at regular intervals in the given calendar year. They give mass drug administration to the children, pregnant women and adolescents to ensure that they are being taken care of in this issue actually. So what are the major achievements of this one? There have been good gains out of Anemia Mukt Bharat. States like Gujarat, Karnataka, Madhya Pradesh, Maharashtra, Odisha, Rajasthan, Telangana, Uttar Pradesh and West Bengal have achieved significant progress in this program. Close to about 4.2 crore children between 0 to 19 years have been tested and diagnosed to have anemia. Almost about 2.5 crore adolescent girls have been tested and diagnosed. Almost about 3.2 crores pregnant to have been tested and diagnosed. It means through the program, close to about 6.2 plus almost about close to about 9 plus crores population has been reached with testing and diagnosing anemia, and of course they are all going to get supplementation and other support to treat anemia. So similarly, 1.6 crore lactating mothers have been diagnosed and tested. 3.2 lakhs anemia awareness camps have been held across the country. 5.6 lakhs health workers have been trained. So this is the progress that's been made in the Anemia Mukt program up to 2023. So coming to these are some of the achievements where, as I told already, 4.2 crore children, 2.5 crore adolescents, 3.2 crore pregnant who have been tested and diagnosed with anemia, and almost about 1.6 crore lactating mother, 3.6 lakhs camps have been held across the country, almost 5.5 lakhs healthcare workers have been trying to implement Anemia Mukt program. These are some of the achievements, but what are the limitations actually? There is a significant gap seen in the dissemination and implementation of the program. Only 5 to 6 states have been able to develop their own language material and distribute in their states. Otherwise, in 2019, only 18 states had made allocation for providing this service in their country. So it means 50% states are making allocation for targeted beneficiary. It means that despite the efforts of this program and despite the progress achieved through that, only nearly 50% of the states have been able to take up this seriously and implement. Madhya Pradesh is one such place where It stands as a number one Anemia Mukt Bharat index state. It has various issues like there was a low accuracy of the screening, low uptake iron folic acid uptake due to side effects. They also noted suboptimal procurement and distribution thing, lack of concurrent monitoring, limited knowledge on the importance. So these were the areas they found out there was necessary to implement. Similarly, they look at that there has been significant concern with sickle cell disease. They wanted to supplement. So what is the impact on this? 2017 to 19, they have been able to improve their facilities and it reached from rank 6 to rank 1 in achieving Anemia Mukt Bharat. These are the progress made in Madhya Pradesh, where anemia testing has improved, IAP formulation has improved, supply chain has improved, monitoring has improved, and IAP uptake has improved actually. Haryana is another state where the work has been significantly improved. Actually, they also looked at strengthening the nutrition and dietary counseling services, access to the iron folic acid food containing foods like jaggery, pulses, nuts, green leaf vegetables, monitor and assess the anemia and prevalence in the state regularly, increase awareness about anemia, and encourage intersectoral collaboration and convergence of health, nutrition, and agriculture program to ensure this program is effectively implemented. So what did they found actually? They provided iron folic acid to the pregnant and lactating mothers and women and children, provided nutritional education and counseling service to the pregnant women, lactating women and the children. They strengthened the capacity of frontline health workers in detecting, diagnosing and treating anemia. They implemented evidence-based approach in prevention such as food fortification and biofortification. So these are the steps that taken by Haryana that helped in implementing successfully Anemia Mukt program. So these are the two states examples suggesting that how this program has been taken care of and implemented, and there is a long way to go. Based on these experiences, you can say that the future goals include continue to focus on improving maternal and infant health outcome as well as addressing anemia at individual level, family level and community level. Program plans to roll out intervention targeting high-risk groups, subgroups, developing the program's digital platform to help people to go through that, ensure consistent service delivery, continuous impact monitoring, scaling up nutrition-sensitive interventions, and working with partners to further support strengthening the program. The ultimate goal of the program is to make India anemia-free by 2030. That's been the goal actually. So let's all make India anemia-free and let's make everybody healthy. So this is about this topic actually. I'm sure you were able to cover almost all the points required to that. And what is required is everybody's effort to ensure that we reach every eligible population to reach out and provide the support required to ensure that India is Anemia Mukt Bharat by 2030. Thank you so much.